Oxygen is like the lifeblood of our bodies, keeping everything running smoothly. Did you know that sometimes our oxygen levels can drop, causing potential health issues? Yep, it's true. When our oxygen levels dip below the normal range, it can lead to a whole array of warning signs that shouldn't be ignored. Before we jump into the signs, let's take a moment to understand just how crucial oxygen is for our bodies and why we need to pay attention to these warning signals. Oxygen saturation, known as SpO2, is a crucial measure of the percentage of oxygen-saturated hemoglobin in the blood. Hemoglobin, present in red blood cells, transports oxygen from the lungs to body tissues. SpO2 is typically measured non-invasively using a pulse oximeter, which shines light through a fingertip or earlobe to assess oxygenated and deoxygenated hemoglobin levels. A normal SpO2 range for a healthy individual is 95% to 100%. Any level less than 90% indicates low oxygen saturation or hypoxemia, meaning insufficient oxygen flow to the tissues. But why you might have low oxygen in your body? There are various reasons why oxygen levels in the blood may not be sufficient. Firstly, respiratory issues like asthma and pneumonia can hinder the lungs' ability to extract and transfer enough oxygen into the bloodstream. Next, individuals with anemia, a condition characterized by insufficient red blood cells or hemoglobin responsible for carrying oxygen in the blood, may also experience this phenomenon. Insufficient red blood cells can result in reduced oxygen transport to tissues and organs. Thirdly, cardiovascular problems, such as heart failure or certain congenital heart defects, can affect the heart's ability to pump blood effectively. This can lead to reduced blood flow and, consequently, insufficient oxygen delivery to tissues. Furthermore, lung injuries resulting from factors like smoking, pollution, or other environmental influences can impair their function, leading to restricted oxygen exchange and consequent low oxygen levels in the bloodstream. Now, let's delve into the 7 warning signs that may indicate low oxygen levels in your body. Disclaimer: this video is intended solely for educational purposes. We strongly advise obtaining professional help for any personal healthcare problems if you are experiencing any discomfort or anxiety with your health. Number 1. Shortness of breath. Shortness of breath, also known as dyspnea, is a significant medical symptom that individuals may experience when their oxygen levels are lower than normal. People with shortness of breath often describe a sensation of not being able to take in enough air, feeling breathless, or having an increased effort to breathe. During normal physical activity or exercise, it is common to experience some degree of breathlessness. However, if shortness of breath occurs at rest or with minimal exertion, it may indicate an underlying health issue, including low oxygen levels in the blood. Shortness of breath can manifest in various ways, ranging from mild to severe, and it can be associated with different medical conditions such as respiratory infections, lung diseases, heart problems, anemia, and more. Number 2. Rapid or shallow breathing. Rapid breathing, also known as tachypnea, refers to an increase in the rate of breathing. In normal circumstances, our breathing rate varies based on physical activity and emotional state. However, when oxygen levels are low, the body tries to compensate by breathing more rapidly to inhale more oxygen and expel excess carbon dioxide. Shallow breathing, also known as hypoventilation, is characterized by taking quick, shallow breaths rather than deep and complete breaths. When individuals experience low oxygen levels, they may unconsciously reduce the depth of their breaths to minimize discomfort or fatigue associated with breathing efforts. However, shallow breathing can worsen the situation by further limiting the amount of oxygen that reaches the bloodstream. This increased breathing rate helps maintain an appropriate balance of gases in the bloodstream. Both rapid and shallow breathing are essential warning signs because they represent the body's attempt to cope with inadequate oxygen levels. These symptoms can occur in various medical conditions such as respiratory disorders or cardiac issues. Additionally, they can be a result of high-altitude environments or situations where oxygen availability is reduced, such as during a severe asthma attack or after certain drug use. Number 3. Fatigue and weakness. Fatigue and weakness are significant warning signs that can indicate low oxygen levels in the blood. When our bodies do not receive enough oxygen, it can have a direct impact on our energy levels and overall physical performance. Fatigue can be described as an overwhelming sense of tiredness or lack of energy that is not alleviated by rest or sleep. It may manifest as persistent weariness, difficulty concentrating, or a general feeling of being drained. In cases of low oxygen levels, the body's cells and tissues may not receive an adequate supply of oxygen, leading to reduced energy production and an increased feeling of fatigue. Weakness, on the other hand, refers to a noticeable decrease in physical strength and endurance. Individuals may find it challenging to perform tasks that were once routine or experience difficulties with activities that require exertion. When oxygen levels in the blood are compromised, muscles may not receive enough oxygen to function optimally, resulting in a sense of weakness and reduced muscular performance. Number 4. Rapid or irregular heartbeat. Rapid or irregular heartbeat, medically known as tachycardia or arrhythmia, respectively, refers to abnormal heart rhythm characterized by either an increased heart rate or irregular heartbeats. Under normal circumstances, the heart maintains a steady rhythm, beating at a specific rate to effectively pump blood throughout the body. However, in some cases, various factors, including low oxygen levels in the blood, can disrupt this normal rhythm. Rapid heartbeat, which is also called tachycardia, occurs when the heart beats faster than usual, typically exceeding 100 beats per minute in adults. In some instances, tachycardia can be a natural response to physical activity, stress, or certain emotions. However, when low oxygen levels are present, the heart may attempt to compensate by increasing its rate in an effort to supply more oxygen to vital organs and tissues. Arrhythmia refers to an abnormal heart rhythm that may involve irregular beats, skip beats, or an irregular pattern. Low oxygen levels can disrupt the heart's electrical signals, leading to irregular contractions. This condition can be potentially dangerous as it may compromise the heart's ability to effectively pump blood and supply oxygen to the body's organs. Please note that the presence of a rapid or irregular heartbeat does not conclusively confirm low oxygen levels in the blood. Number 5. Chest pain. Chest pain is a common symptom that can arise from various underlying causes, some of which may be related to low oxygen levels in the blood. Chest pain is described as discomfort, pressure, squeezing, or a sensation of heaviness in the chest area. It can vary in intensity and duration, and its presentation may be different for each individual. When it comes to low oxygen levels, chest pain can occur due to reduced oxygen supply to the heart muscle, which is a condition known as myocardial ischemia. Myocardial ischemia occurs when there is an imbalance between the oxygen demand of the heart and the amount of oxygen-rich blood it receives. This can lead to chest pain known as angina, which often occurs during physical exertion or stress and typically subsides with rest. However, it's essential not to jump to conclusions or self-diagnose when experiencing chest pain. Numerous other factors can cause chest discomfort, such as gastrointestinal issues, muscle strains, lung problems, anxiety, and more. Number 6. Cyanosis. Cyanosis is a medical term used to describe a bluish or purplish discoloration of the skin, mucous membranes, or nail beds. It occurs when there is an increased concentration of deoxygenated hemoglobin in the blood vessels near the skin's surface. Under normal circumstances, oxygen-rich blood is bright red, while oxygen-depleted blood is darker in color. Cyanosis becomes apparent when the concentration of deoxygenated hemoglobin in the blood vessels rises above a certain threshold, usually above 5 grams per deciliter. This can happen due to a variety of reasons, including reduced oxygen uptake in the lungs, impaired blood circulation, or certain medical conditions that affect the blood's oxygen-carrying capacity. Cyanosis is a significant clinical sign and can manifest in different parts of the body, including the skin, lips, tongue, and nail beds. In either case, it indicates an underlying problem with oxygenation and should be promptly evaluated by a healthcare professional. Number 7. Confusion or changes in mental alertness. This is a clinical manifestation often associated with inadequate oxygenation of the brain. Oxygen is vital for brain function, and when the brain receives insufficient oxygen supply due to low blood oxygen levels, it can lead to alterations in mental alertness and cognitive abilities. Patients experiencing this symptom may display confusion, disorientation, memory deficits, or difficulty concentrating. They might have trouble following conversations, making decisions, or processing information, all of which can significantly impact daily activities and overall quality of life. In severe cases, low oxygen levels can result in a state of altered consciousness, leading to delirium or even unconsciousness. Consequently, it is essential to seek the counsel of a healthcare professional if experiencing prolonged discomfort to accurately identify the underlying cause and receive the appropriate medical care. Thank you for tuning in. Stay tuned for our next video.